Hello my friends, welcome back to my channel. This is Dr. Brain from Medicine Journey. We'll continue with quick daily rounds questions, part 5. So in this part, we'll talk about some cardiac medication and some of the terms related to. So, what do we mean by chronotropic effect? So this means the effect that changes the heart rate. So let's apply it to the cardiac medication we have. When we say this medicine has negative chronodrops, this means this medicine will decrease the heart rate. So what are the examples we have? We have beta blockers, we have digoxin, we have acetylcholine, we have ibuprofen. So these medication, they have negative chronotropic effect. So this means they slow down the heart. So they affect the heart rate negatively, okay? Now, the opposite, some examples of positive chronotrops, we have atropine, we have dopamine, epinephrine, isopinephrine, mirinonin, and thiophylline. So these medications, they increase the heart rate. Another medical term, what's the meaning of ionotropic effect? So ionotropic effect means that change the contractility of the heart. Examples for positive ionotropic medication, that means these medication increase the myocardial contractility. So we have digoxin, we have calcium, catecholamines like dopamine, dobutamine, epinephrine, norepinephrine, isoprenaline. We have angiotensin 2, prostaglandins, phosphodiesterase inhibitors, and glucagon and insulin. So these medications, they increase the myocardial contractility. The opposite, some examples for of negative ionotropic medication, which decrease the myocardial contractility, which has a good effect in some cases like in myocardial infarction or in chronic heart failure. So because they decrease the cardiac workload, okay? So we use these medication which they have negative ionotropic effect like beta blocker, non-dihydropyridine, calcium channel blockers like diltiazem and verapamil. We have class 1A antiarrhythmic medication like quinidine, procainamide. We have class 1C also antiarrhythmic medication like flecainide. Okay, so this medication, they have negative ionotropic, and we use this feature in some cardiac conditions like infarction or heart failure. What's the meaning of drombotropic effect? So drombotropic effect is the effect that changes the conduction velocity. So the conduction speed in the AV node. Example, so when we have positive drombotrop, so we have like we stimulate epinephrine. If we have negative, so this is the vagal stimulation. Some medication that they have negative drombotropic effect, same as like beta blocker and calcium channel blockers. These medications, they decrease the conduction speed in the AV node. Last question in our review today, among beta blockers medications, which ones are cardioselective? It's a very common question in clinical practice. So which ones of the beta blockers are cardioselective? So we have 3, atenolol, bisoprolol, and metoprolol. And given that bisoprolol is reported to be more cardioselective than metoprolol and atenolol, but all of them, they are cardioselective, and the most one is bisoprolol. So this is the end for today. Thank you for watching. If you like, please don't forget to like and subscribe. Thank you. See you soon.